Let's discuss the Public Health Bag Technique. This clinical policy 2.02 can be found in the Home Health Services Clinical Manual on the DHEC Internet website. First, you want to place your bag on a hard, flat surface. Avoid placing your bag on overstuffed furniture or a bed. Place newspaper as necessary. Then place your bag in the center of the paper. This provides a barrier from your clean and dirty work areas. Then you want to open your waste disposal bag. Place it on the dirty work area of your newspaper. It is also recommended that you place newspaper under your laptop. Take your laptop out of your laptop bag and place it on a firm, flat surface. Open your laptop and turn it on in preparation for work. Then remove your soap and alcohol-based hand sanitizer from your bag. Also remove your paper towels. Place them on the newspaper in preparation for hand washing. In some areas, there may be no hand washing facility available. If this is a problem, the nurse may use an alcohol-based 60 to 70% hand sanitizer. If there is water available, place 1 to 3 ml of the non-antimicrobial or antimicrobial soap and then wash your hands vigorously for 10 to 15 seconds. Once you have washed your hands thoroughly, rinse them. Dry your hands with a clean paper towel. Note that the nurse will turn the faucet off with the paper towels. Place your dirty paper towels in your waste disposal bag. Open the nursing bag and remove all equipment that is going to be needed for patient care. The thermometer should be cleaned before and after each use. Each patient should have his or her own thermometer, especially if there is the potential for infection or fever. If the patient is unable to obtain or does not have a thermometer in his or her home, the nurse should leave one for them. The nurse should use a plastic sheath over the thermometer when using her own thermometer on the patient. It is also recommended that the nurse place paper towels between the patient and the blood pressure cuff when checking the patient's blood pressure. If the patient has open wounds or draining lesions, the nurse must place a plastic covering over the wound before placing the blood pressure cuff. If the blood pressure cuff becomes visibly soiled, the nurse must clean it following manufacturer instructions or place the blood pressure cuff in a plastic bag and return it to the agency. Once the nurse has completed using her equipment, she must place it on the dirty work area of the paper. Note here that the nurse is cleaning the thermometer. However, she could just place it on the dirty work area of the paper and clean it later before placing it back in the bag.